Your knee is talking to you. Every day, every moment, it's sending you signals. Problem is, most people don't understand this language. They ignore these signals until they become screams. They attribute them to age, weather, chance. But after 30 years working as an orthopedic surgeon, I've learned to understand this language. And today I'll teach you to listen to what your knee is trying to tell you, because this is truly important. This could be difference between healthy knees for life and operating table in few years. Let's start with most common signal, morning stiffness. You wake up, get out of bed, and your knees are stiff, inflexible. Takes a few minutes for them to work out. Most people think, well, I'm over 40, this is normal. But you know what? This isn't normal. This shouldn't be norm. Your knee is telling you, muscles around me are weak and inactive. While you slept, they completely shut down, and now I need time to remember how to work. Morning stiffness is early sign that your stabilizer muscles aren't performing their job properly. Quadriceps, hamstrings, calf muscles, they should be ready to support your knee any moment. But when they're weak, or when neuromuscular connection is disrupted, they need warm-up time. This is warning signal. Your knee is saying, strengthen muscles around me, restore brain, muscle connection, or it'll get worse. Second signal, pain going downstairs. Climbing up is fine, but going down hurts, especially in front of knee, around kneecap. This is incredibly common, and most doctors will tell you it's patellofemoral syndrome and prescribe anti-inflammatories. But your knee is telling you something more specific. It's saying, my quadriceps is too weak to control load going down. When you descend, entire load falls on joint instead of being absorbed by muscle. You see, climbing stairs, quadriceps pushes you up, concentric contraction, relatively easy for muscle. But descending, it must work eccentrically. Controlling body, lowering, this is much harder and requires more strength. If quadriceps isn't strong enough for this eccentric work, entire load transfers directly to joint. Cartilage under kneecap compresses, pain occurs. Your knee is screaming, strengthen quadriceps, especially eccentric strength. Third signal, crunching or clicking in knee during movement. Most people get scared hearing knee crunch. Something broke? Is it arthritis? But here's what's important to understand. Not all sounds are bad. If knee crunches or clicks, but there's no pain, no swelling, no movement limitation, it's often just sound of gas bubbles in joint fluid or sound of tendons moving across bone protrusions, like when you crack knuckles. Not dangerous. But if crunching accompanies pain, if after click knee locks or swells, that's different. Then your knee is saying, there's a mechanical problem here. Maybe piece of meniscus interfering with movement or cartilage damage creating roughness. This is signal requiring professional assessment. Fourth signal, instability. Feeling that knee might give out, especially during turns or on uneven surface. This is frightening feeling, and many people start avoiding certain movements because of it. Your knee is saying very clearly, my stabilizers aren't working. Glutes are sleeping. Deep core muscles not activated, proprioception disrupted. Proprioception is body's ability to sense position in space and react to changes. When it's disrupted, your knee can't quickly stabilize during unexpected movements. Interestingly, instability often arises not from ligament damage, but from muscle weakness and neuromuscular control disruption. And this is good news because this can be fixed with balance and strengthening exercises. Your knee is asking, teach me to feel ground again. Strengthen stabilization system. Fifth signal, swelling after activity. You walked more than usual or played sports, and by evening, knee is swollen. Not much, not hot, just a bit more than usual. Your knee is saying, load you gave me exceeded my current recovery capacity. I'm not ready for this activity level. This doesn't necessarily mean you damaged something. It means you exceeded current tissue adaptation. Solution isn't to stop activity, but to gradually build it up. If after 1 kilometer run knee swells, Don't quit running. Instead, run less but regularly, giving body time to adapt, strengthen muscles, gradually increase load. Your knee is asking, give me time to become stronger. Don't overload me, but don't leave me without work. Sixth signal, pain appearing after sitting. You sit 1 or 2 hours, then stand up, and first few steps, knee hurts or feels stiff, then passes. This is called theater phenomenon or chair sign. Your knee is saying, when you sit long, especially with bent knees, pressure on back of joint increases. Synovial fluid stagnates. Muscles fall asleep. This is signal you need to move more during day. Stand up every 30 to 40 minutes. Extend and bend legs. Walk. Modern sedentary life kills knees, not so much through direct load as through lack of movement. Joints feed through movement. It pumps synovial fluid, delivers nutrients to cartilage. Without movement, cartilage starves. Seventh signal, pain on inner or outer side of knee. If pain is strictly on inner side, your knee may be saying, I have problem with medial meniscus or medial ligament, or more likely, my legs collapse inward when walking, creating excessive pressure on this side. Outer side pain often relates to iliotibial band, dense strip of connective tissue running along outer thigh. When it's overstrained, it rubs against bone on knee side, causing inflammation and pain. In both cases, your knee is speaking not only about local problem, but about biomechanics problem of entire leg. Maybe foot pronates too much. Maybe glutes don't stabilize pelvis. Maybe you're wearing wrong shoes. One-sided pain is almost always biomechanical signal. Eighth signal, weather-dependent pain. Knee aches before rain or in cold weather. Many doctors are skeptical about this, but patients insist it's real. And you know what? Research shows this really exists. Barometric pressure changes can affect joints. Your knee is saying, I have inflammation. Maybe low level, chronic, but it's there. And pressure changes make it more noticeable. This is signal to pay attention to factors affecting inflammation. Nutrition. Are you eating many inflammatory foods? Sugar, processed oils, refined carbs. Sleep. Are you getting enough? Lack of sleep increases inflammation. Stress. Chronic stress maintains inflammatory state in body. Your knee is asking you to look at overall health, not just joint. Ninth signal, night pain. Pain that wakes you at night or prevents falling asleep. This is serious signal that can't be ignored. Your knee is saying something significant happening here. Either inflammation is severe, or there's structural problem, or nerve is pinched. Night joint pain always requires medical evaluation because it may indicate more serious conditions. 10th signal, asymmetry. One knee behaves completely differently than other. If both knees hurt same way, it's often systemic problem, maybe arthritis, maybe general muscle weakness. But if one knee is very different, this speaks of local problem in that specific leg or that side of body. Maybe old ankle injury on that side changed your gait. Maybe scoliosis creates asymmetric load. Your knee is saying, figure out why I'm different from other side. So what to do with all these signals? First and most important, listen. Don't ignore. Don't attribute to age. Every knee signal is information. Your body is incredibly smart, constantly adapting and trying to maintain balance. When it sends pain or discomfort signal, it's not attacking you. It's attempting communication. Second, act early. Most serious knee problems start with small signals ignored for years. Morning stiffness not taken seriously becomes chronic pain in 5 years. Instability that's ignored leads to fall and serious injury. Light swelling after activity that's disregarded develops into chronic inflammation. Third, learn your body's language. Pay attention to patterns. When exactly does knee hurt? After which actions? What time of day? How long does pain last? What relieves it? Keep diary if needed. More information you gather, easier it'll be to find cause. Fourth, find specialist who also knows how to listen, not one who just looks at MRI and prescribes medications, but one who asks questions, observes your movements, checks whole body, understands system connections. Specialist who perceives your knee symptoms as messages requiring deciphering. Your knee is talking to you right now. Even if it doesn't hurt this moment, it's sending signals about how it feels, what it needs, where weak spots are. Question is, are you listening? Because if you learn to listen and understand these signals, you can prevent most serious problems. You can keep your knees healthy for life. Don't ignore what your knee is trying to tell you. This is truly important.